everyone, my name is Zaina, and in this video I'm going to be discussing everything you need to know about the NDECC exam. This video is going to be two parts. Part 1 is going to be focusing on the clinical skills part of the exam, and part 2 will be discussing the situational judgment part. The highlights are going to be the NDEB equivalency process, and then I'm going to dive into the NDECC exam in specific, explaining the protocol and the practical guide, in addition to the registration process, how to prepare for the clinical skills part, and the exam day, following up with the results and the repeating procedures. So let's begin. Before I start with the NDECC exam, I'm going to give a brief overview of the NDEB equivalency process. The NDEB equivalency process is basically the direct licensing system by the Canadian National Dental Board. It's put in place for internationally trained dentists trying to obtain their license and practice in Canada. It's one of the pathways to be able to get your license here. So the NDEB equivalency process is divided into 3 equivalency exams. The AFK, once you pass the AFK, you move on to ACJ. When you pass the ACJ, you move on to the NDECC exam. After clearing 3 exams, you move on to the certification process, which is the OSCE. There is another pathway in Canada to get your license, which is the university route, the IDAP programs. Basically doing 2 years in a Canadian university and then obtaining a DDS degree. To get into the university, now most of them are requiring the ADAT exam. I have a full everything about the ADAT exam video explanation here on our channel on YouTube, so make sure you check that out as well. So to just be clear about one point, the direct licensing route will allow you to practice in Canada only. However, the IDAP program, which is 2 years in a Canadian university, will allow you to practice in Canada and America as well. However, a third route that some people take to practice, and it allows you to get a DDS degree as well, a 2-year university program in America. And the way to get the admission is to take the INBDE exam. I have also a full INBDE explanation video on our YouTube channel if you wanted to know more about that as well. Going back to the NDEB exams, once you clear your AFK and ACJ, you move on to the NDECC exam. The best source and the main source actually to get to know more about the NDECC, especially in the beginning, is to visit the NDEB website. Starting off with the NDEB equivalency process, the NDEB website, the main website you should visit when you are trying to apply to the process, taking any exams, want to know any date, any kind of solid information, you should go to this website. So when it comes to the equivalency process, like I said, it starts with the AFK, ACJ, and then NDECC exam. Moving on to the certification process, the OSCE, and then the provincial certification and the provincial licensing. We have some information about the equivalency process, and our concern for this video is going to be the NDECC. And here you can read about the NDECC exam, some history, the format and content, and you can download the 2 main documents that you need to be very familiar with, which is the NDECC protocol and the NDECC practical guide. These folders are very important and they are updated fairly frequently by the NDEB, so keep an eye on them to be familiar with the most updated version. So, and then if you scroll down, registering for the NDECC, some information about the registration, withdrawal, and the dates. This is where they say all the upcoming NDECC sessions. They are listed a year ahead of time, so you will know to plan ahead when to register. So it says the registration deadline, the exam date. For these exams, it's closed, and frequently asked questions as well. It's good to go over these questions and know them just in case. For the NDECC sessions, this is the NDECC calendar. It shows all the sessions for the whole year. So we are in February 2024. These are the sessions for the cycle. Moving on to March. So there are 4 cycles a year. The first cycle started in January 10. So you can see NDECC session 10, 11, 15, 16, 17, 18. And it goes till February. And the last session in the cycle is February 29th. Now, if we go to March, then we can see the evaluation session for that cycle. So the evaluation session is the time that the NDEB evaluates the whole cycle as a bunch. So January and February, that's one cycle. In the year, the evaluation session will extend from March 14 to March 18 for that year. And then the results will come out at least 6 weeks from this date. So March 2024, March 18, you count 6 weeks after that, then you can start expecting your results for that cycle. And so on, the same thing for cycle 1, cycle 2, cycle 3, and cycle 4 of the year. You'll find all the dates available in this calendar. So that's the review of the NDEB equivalency process as a whole. If you need any information about videos that we have before the NDECC step, you will find them on our channel. Now, moving on to the NDECC exam. It's the third exam in the NDEB equivalency process. Once you clear the AFK and ACJ, you move on to the NDECC. It is made of two components. Component 1 is the clinical skills, and component 2 is the situational judgment. A lot of people get scared and overwhelmed about the NDECC exam the more they know about the requirements, because for any dentist that just cleared AFK and ECJ, they're used to either studying with their friends or at home, doing their course, doing the requirements, and then doing the exam. But when it comes to the NDECC, it's a combination of many things, which is financially, physically straining, and you have to be mentally ready to accept and train for every requirement of this exam. The risk is high, but at the same time, it's the third equivalency exam. So if you clear that, you're basically done. You move on to the OSCE and you get your license. So it's important to approach it with the lowest risk possible, which means getting the right training and investing the right time in practicing for this exam. Now you're at the NDECC part of your licensing journey. The first thing is you're going to go to the NDEB website and read more about the NDECC exam, the dates, the locations, all that stuff. The second is you're going to be familiar with something called the NDECC protocol. This document is very important to understand and get to know the exam better. It has all the details about the schedule of the exam, the content of the skills and the judgment, and the most important thing is the clinical skills grading criteria. The NDECC protocol, like I said before, it's on the NDEB website. You can click to download it. This is going to take you to their page where you have some tips for the NDECC, the reference list for the situational judgment, and a video by the NDEB, which is 8 minutes long, explaining of what to expect on the exam day. So this is the protocol. I would say read this document word by word, understand it very well before you even think about preparing for the exam. Going over it with you very quickly, the NDECC is a 2-day examination where you will perform 7 clinical requirements on simulated patients and 10 situational judgment stations. What that means is that the exam is composed, like I said, of 2 days, clinical skills, which is a lab day. They are 7 requirements as projects, plus 1 infection control is considered a requirement. So the whole clinical skills will be considered 8 requirements. So 7 projects plus infection control. When it comes to the situational judgment, it's 10 stations over 4 hours. So the clinical skills component is a full day, situational judgment is a half day. There is no guarantee that you're going to have clinical skills first and then judgment, or judgment and then skills. That is determined by them. They email you a few weeks before your exam to tell you that your day 1 is going to be skills or day 1 is going to be judgment, and vice versa. So the requirements are the Class 2 amalgam preparation, which is the MOD, the Class 2 amalgam restoration, the Class 2 composite restoration, the endo access preparation, a crown preparation, a provisional restoration on your crown preparation, and the Class 4 composite restoration. These are the 7 projects. Plus, infection control is a requirement that is you're going to be assessed on during the time of your exam, the whole time. So as you're doing your projects, the invigilators will be assessing you for infection control as well, which makes it a total of 8 requirements. They don't specify a technique that you have to be following to do your project. They state that you must perform the requirements as if you're working on actual patients. And no dental dam is required to perform any of the requirements. They just want you to basically work that day as if you're working in a clinic basis, using the right infection control, the right techniques, the standard of care, the Canadian standards, basically, to perform these projects. And like I said, infection control and safety, you must follow infection control and safety procedures and work in the right positions as if you're working on a real patient. Component 2 is the situational judgment. I will go over these in part 2 of the video. This video is just going to focus on the clinical skills. Clinical skills, equipment, instruments, and supplies, basically just telling you that they're going to be providing you with the equipment, material, instruments, everything. So you don't have to bring anything with you to the exam except your personal loops. So before I jump into the grading criteria for the skills projects, it's important to know how the NDEB is going to assess your projects, your work. The assessment is based on 3 categories: the competent, which is going to be considered a pass; the minimally competent, which is also a pass. It's not as good as the competent, but you're still within the acceptable level. And the third one, which is a fail, the not competent category, which means that your project failed to be within the right criteria for it to be acceptable. So if we see here, to pass the NDECC exam and move on to the OSCE, you must pass both the clinical skills and the situational judgment. But if you fail either of these components, so let's say you failed the clinical skills and you passed the situational judgment, you don't have to repeat the situational judgment again. You just have to repeat the clinical skills, and vice versa. If you pass the clinical skills and fail the situational judgment, you just have to repeat the situational judgment part. You have to repeat the failed component until you achieve a pass on both components, the clinical skills and situational judgment. Then you can move on to the OSCE. So back to the document, the clinical skill requirements are graded using a pass or fail system with critical errors. You must pass all the clinical requirements to pass the clinical skills component. What does that mean? That means that in order for you to pass the clinical skills component, you must pass 8 out of 8 requirements. If you fail any of the requirements on the skills, then you do not pass the clinical skills component. You would have to repeat that day of the exam. Now, going over this table, the competent means this is the best clinical outcome, optimal preparation, restoration, there are no errors. This is in the pass grade. Minimally competent is also in the pass grade. However, some improvements could be made. You have a little bit of over preparation, under preparation, a bit of damage, but nothing that's going to be detrimental to the health of the tooth or the gums or the soft tissue of the patient. The fail happens when you are in the not competent category, which means that your errors indicate a lack of clinical skills or judgment, errors not correctable. They compromise the clinical outcome, alternating the treatment required to fix your errors. When it comes to grading of infection control and safety, is graded as you're working in the day of the exam. The invigilators will be watching you and writing notes on how you're working. Are you sitting in the right positions? Are you violating any conditions for the infection control? You're assessed throughout the clinical skills component for the infection control and safety. So for the whole 8 hours, you have designated forceps to take supplies from the drawers. So this part, honestly, you don't have to worry too much about it because During your exam, in the orientation, the invigilators will let you know exactly what you can touch, what you cannot touch. You can ask them questions and clear your doubts about any infection control and safety rules and regulations that you want to ask about. So they've also listed the common errors or the errors that you should definitely avoid, and you can go over these one by one. There are some important information and regulations that you have to know ahead of time before going to your exam. So the important information about arriving late. If you arrive late, you can't have extra time for the clinical skills and situational judgment. If you missed any of the stations in the situational judgment, for example, you cannot make up the stations you missed. Those stations will be considered an automatic fail. The invigilators will not answer questions involving examination content. They will only help you with any material or instruments that you need, any problem with the mannequins, but not specifically about the projects themselves. You're responsible for any damage caused to the equipment. In the exam, you'll receive a communication form. And this form, you have to fill it if you have anything that you want to tell the evaluators of your exam. Make sure you fill that out during their exam session, and that will be taken into consideration in the evaluation. So, for example, if there's any problem that you encountered with your teeth, anything that you want to tell the evaluators that are going to be evaluating your projects later on, you can write it down in the communication form and explain the reasoning that you have. Also, going down to the regulations, you have specific instructions. If you are not following the regulations, there is a misconduct that could happen. So for the clinical skills component, you are not permitted to bring anything into the test center other than your loops, your headlight, batteries, and your lunch. You cannot bring your watches of any kind, any telecommunication or transmitting devices. You cannot remove teeth or alter the position of the teeth in the typodont. If you do have any issues with your teeth, tell your invigilator. You cannot remove the typodont from the mannequin, sharing impressions, removing any material. And for the situational judgment component, same thing, you cannot bring anything that is out of the ordinary. When the time ends, you have to stop your examination and leave the clinic or situational judgment room when asked. There are rules for misconduct as well, so make sure you read that as well. Now, moving on to the grading criteria. Basically showing what the NDEB is requiring of you for each project, the criteria that you need to be within to be able to pass each project. Starting off with the first project, the Class 2 Amalgam Preparation, the MOD. What are some things that you have to look out for? Just to give you an idea of how each project is looked at, what's considered not competent, basically how to read the whole table. So each project will have columns, 3, 4, or 5 columns. So for the Class 2 Amalgam Preparation, we have the outline, the internal form, the finish, and the damage. These are the 4 things that the evaluator looking at your project is gonna look at. And in each column, there are certain criteria that you have to follow to be considered either a pass or a fail. What your goal is to be in this margin of all the columns. Once you're in this area, that means you will pass. But if any of these columns goes into the not competent area, then your project is a fail. So let's say they looked at your outline form and let's say they determined that this part is within this area. They gave you a minimally competent on your outline form. They're going to move on to your internal form, and let's say they gave you on the internal form a competent. So now you have a minimally competent on your outline and a competent on your internal form, and then they're going to move on to your finish. And let's say at this column, you got a minimally competent. They're going to move on to the 4th column, which is the damage. And let's say they're going to give you for this column, not competent. And that means that even though you got a minimally competent, a competent, a minimally competent on the other columns, you still had a not competent on the damage column, which means that you failed the project. Also, keep an eye out to the critical errors as well. This is also in the not competent. So a quick piece of advice when it comes to the criteria, one of the things that you could keep in mind is to stay away from this part. Your measurements, your preparation, the damage, the finish, everything should be away from this part and the critical error, of course. And when you finish and assess your tooth, make sure that you are not falling into any of these parts. And that way you will know that, okay, I'm in the safe zone. I could either be in a competent or minimally competent, but I'm definitely not in the not competent section. To achieve that, however, takes a lot of time of practice. It takes a lot of training to get your hand used to cutting in the right way. So when it comes to the MOD preparation, it's a cutting project. It takes a lot of time to practice. You will need the right guidance and training by the right instructors to help you and tell you how to cut your project, what you should avoid, how to position your cavity, how to assess your project after you finish it to make sure that you don't have any not competent errors. As you can see in the table, there are certain measurements required. And because the NDEB doesn't say as well which tooth the MOD can be on, it can be on any posterior tooth in the mouth. So it's important to practice on all the teeth. And each tooth has a certain way to cut it, has a certain way to avoid the damage, has a certain way to check the divergence of the walls and all that stuff. Moving on to the Class 2 amalgam restoration, the filling can be on any of the teeth. None of the projects are specified on which tooth that you will do your projects on. The tooth will be a pre-cut tooth, so the cavity will already be there. You have to fill it. Practicing amalgam also takes time. A lot of people are scared of it because of the fact that the amalgam sets. It's a time-controlled project, and that's why a lot of people are scared of it. Another reason it can be tricky is because of the complications that can happen. What's important is not only to practice doing the filling itself, but also practice repairing the complications that might happen. Just in case anything happens in the exam, you'll know how to fix it and fix it fast. So looking at the table for the grading criteria of the amalgam, we have 5 columns that are assessed. The evaluator is going to look at your margin, the margin between the tooth structure and the amalgam filling, proximal contours. They will be assessing you as under-contoured or over-contoured, and they're specifying exactly the points that will cause your project to be not competent in this. And then occlusal morphology and function. This goes back to your carving and the morphology that you're giving the tooth, in addition to the occlusion. Finish and damage as well are assessed. Critical errors, such as foreign objects, wrong use of material, the restoration itself is fractured or loose. Also, an important thing to know about the grading criteria is that projects are assessed by the evaluators. You are only given a pass or fail for each project. You're not given a specific explanation of your report. So when they assess your project, they're going to assess it column by column, but you will not be able to know what actually went wrong in your project. You will just get a pass or fail result. Okay, moving on to the third project, which is the Class 2 composite restoration. Just like the amalgam restoration, you will get a pre-cut tooth. The shade of the composite is pre-selected. So going over the table quickly, there are 5 columns, just like the amalgam restoration, and almost the same criteria in the columns as the amalgam restoration. I highly encourage you to go over each and every box and learn them very, very well to have a better understanding of what to avoid and how to be in the safe zone. The Class 4 composite restoration can be tricky as a project for several reasons. It is an aesthetic restoration. You have to deal with composite, you have to remove excess, porosities and contamination might happen at any point. Finding your own technique to do it is one of the hardest things to find in the beginning when you start practicing for this project. You're gonna have to try different techniques and see what works best for you. Also, 5 columns of evaluation. You have to think about the anatomy when it comes to the gingival health and the aesthetics. Roughness, that could cause plaque buildup, so you have to keep that in mind. Contamination, very important to be careful of, and damage, of course, as well. The endo access cavity preparation is one of the projects as well. The teeth provided in the exam are special endo teeth. They are a bit more expensive than the pre-cuts and the plastic teeth. Endo project is one of the projects that if you master it and you know how and where to open up the access, it becomes very easy and very fast for you. So make sure that you practice it very well and you know the right positioning of the access opening for each tooth. We have 4 columns. The external outline, which is the extension of your access. The second column is the internal form. So going in the enamel, the dentine, and reaching the pulp horns. Make sure to know where the canals are situated, and also perforation. Finishing and damage. Make sure that the walls are smooth, no pulp material present on the walls or floor of the pulp chamber. The roughness on the cavo surface, leaving excessive pulp material on the wall or floor, and debris obstructing the pulp chamber. And of course, the damage to the tooth or the adjacent teeth, the soft tissue, even damage that has been repaired with restorative materials. Moving on to the crown preparation project, we also have 5 columns of assessment. Path of draw is a column by itself. It's very important to understand how to assess if you have undercuts, whether this preparation is going to allow the fabrication of provisional or not, the axial walls, and the axial conversions as well. Second column is the preservation of tooth vitality and structural durability. How much did you reduce from the tooth? Over reduction, under reduction. Margin is a column itself, and that is determined by the type of crown preparation that they ask you to do in the exam. It doesn't say what type of crown preparation here, so you have to see from the exam itself whether it's a PFM or anything else. Also, the positioning, whether it's supragingival, subgingival, finishing and making the line angles and the surfaces smooth, and the margin as well, removing unsupported enamel. In addition to damage, like I said before, the cutting projects are riskier with the damage. It says also here, clearance will be checked in maximum intercuspation. The last project that we're going to talk about is the provisional crown. So you're gonna do your crown prep and then you're gonna do your provisional. So this project has 3 columns of assessment. You're gonna be evaluated on the margin and adaptation between the provisional crown and the tooth itself. Underextended margin, under-contoured, overextended, over-contoured, all these things. And the morphology and occlusion, the contacts, the embrasure area. Also, they're gonna check it with floss, just like the restorations, the amalgam and the composite and the class 4, and whether seating the provisional or removing it. Finish, they're going to look at roughness, causing the floss to break, porosities that causes the patient discomfort or food retention, excess restorative material, any excess in the margins. So that's it for the grading criteria of the clinical skills project. You might look at all these tables and think that, okay, I'm a dentist, I know this already, I've studied this in school, I can easily just follow this and clear my projects. However, the reality of it is that as you can see all these measurements and the columns and the grading that happens for each project, and how a small mistake or one not competent box in any of the projects or any of the columns can lead to a fail of the project and fail of the skills component, the risk is high. So that's why at Prep Doctors, we encourage to have the right training, have the right assessment, the right evaluation by the skilled and trained instructors to determine and learn over time how to do your projects, how to assess your mistakes, and how to fix your complications as well. Now, that doesn't come easy. It takes time, it takes effort, it takes training, it takes dedication, and it takes months to master and get to the point where you feel like, okay, I am confident enough, I'm ready enough to enter this exam. The risk of anything happening and you not able to fix it is lower because you've trained for a while, you have the right guidance, and you've practiced on all the teeth, the right amount of time to master them all, to do them all in also a timely fashion. So you need to also be able to fix your problems and your complications fast as well to stay in the 8-hour limit. Moving on to the NDECC practical guide. It's also a document provided by the NDEB to explain basically the test center, the facilities provided, frequently asked questions, the equipment, the materials specifically that are going to be given to you the day of the exam. So it's important to also revise that and know exactly what to expect the day of the exam. So this is the NDECC practical guide for candidates. The contents, I'm going to be going over them quickly with you. Where is the NDECC exam held? It is held in the NDECC test center in Ottawa, Ontario. They give you the exact address and location and information to find it, specific information about how to find the center, the schedule as well for the exam. You will receive a detailed schedule when your registration is confirmed. So that means that you're going to get information about whether your clinical skills is going to be day 1 or day 2, situational judgment as well. And for either day, the exact time, so when to show up to the center, the registration time, orientation starts at 8 a.m. sharp for clinical skills. The procedures, the exam itself starts at 8:30 a.m. and you go on to 12:30 p.m. There is a break from 12:30 to 1, which is a half-hour mandatory break. And then the exam continues from 1 to 5 p.m. Once it hits 5 p.m. sharp, the exam ends for skills. That's the full day of clinical skills. Once the exams finish, so 5 p.m. hits, you can't have any extended time. Some information about arriving to the test center, basically like providing your photo identification. One piece of ID is okay, such as your driver's license, your passport. Anything that has photo identification is acceptable. The locker room is where you're gonna put your stuff, and it shows a picture here. It has a code. You're gonna leave all your stuff there. For the clinical skills part, you are only allowed to have your loops with you, the loop charger, and any extra batteries for your loops, in addition to your lunch. The examinee lounge, this lounge is where you are gonna have your mandatory break for the clinical skills, and it's where you're going to be resting for a bit before the exam starts and you go to your designated labs. Simulation clinic is where you're going to do your clinical skills exam. The staff will be there to direct you and help you throughout. They're just saying some information about the simulation clinic. It has ADEC units with mannequin heads, typodonts, Kilgore. From the clinic, you can access the examinee lounge, private room, and washrooms. So they're all connected. This is a picture of the lab. As you can see, there are simulators facing each other. There's a lot of space to sit and move around. Special simulators for left-handed people as well are present. The situational judgment rooms are a different space than the simulation clinics, the simulation lab. You'll have an orientation before you start, and then you will be taken to the hallway that has the 10 situational judgment rooms, equipment, instrument, materials, and supply. Like I said previously, for the clinical skills component, you don't have to bring any equipment, any material, no handpieces with you except your loops. That's because they provide you with everything that you need the day of the exam. It's all going to be on your station, ready and set for you to start working. What the NDEB has provided as well is the list of the specific instruments and materials that are going to be in the exam. Sometimes they're updated, so I have to keep an eye out on the latest materials, additions. Sometimes they add things or remove things, so always good to review that part before you start preparing. Here is a full list of the equipment and the materials. You should go over them one by one, specifically to make sure that you have everything. Make sure that you have enough material to practice, but not too much material, because you don't know, maybe they will just at some point remove that item from the list and replace it with something else. Typodonts and teeth. Beginning October 1st, 2024, the 700 series typodont and simulated teeth from Kilgore will be used. So they have replaced the previous typodont and teeth with the 700 series. So make sure that if you are going to give your exam starting October 1st of 2024, any date after October 1st of 2024, that you have you have practiced and prepared yourself for the 700 series and not the previous Kilgore teeth and typodonts. At the end of the document, you have frequently asked questions like, what do I need to bring to the test center? Can I bring a watch? What do I wear? And at the end, you will have the pictures. Pictures are just there to just give you an idea of how things are going to look. This is the mannequin, your station, the drawers that will have the material inside it, your instruments here. This is a closer picture of your setup, your instruments, the mannequin, ADECC simulators, the mobile dental cabinet, and it's labeled with the material that you're going to have. Even pictures of inside these cabinets, the materials, the burrs, the cassette of your instruments, and the crown prep materials. Now that we've covered the clinical skills part, you've gotten yourself familiar to the structure of the exam, the question is now how to prepare for the NDECC exam. It's important to know that when it comes to clinical skills, the preparation starts before you even get your ACJ result. Why is that? It's because you have to plan yourself ahead of time that, okay, if this is something I am sticking to, you have to know ahead of time, finding the right loops for you, the magnification part. So once you put your order in, whichever company that you choose, it's going to take at least 6 to 8 weeks. So order your loops, have yourself ready and in the right mentality that if my results are good and I pass my ACJ, I'm ready to practice right away. Another thing to think about is the lab that you're going to practice in and the seats available. Just a brief introduction to Prep Doctors. For those who don't know, Prep Doctors is a private training institution that has been helping dentists over years clear their exams. It was established in 2011 and until this day has helped thousands of dentists clear their exams. Prep Doctors has also expanded and now is helping pharmacists and nurses, in addition to dental assistants across Canada, America, and Australia, to clear their examinations as well. When it comes to the NDECC exam, the course that Prep Doctors provides is a comprehensive course. It goes beyond just preparing you and actually giving you a spot in their labs. It's a plan, a roadmap actually to help you plan your exam, finance your preparation, do your course, do your mock exam simulation, and get you ready until the day of the exam. So when you're in the planning stage, one of the things you want to plan is where you're going to practice. There are Prep Doctors labs across 5 locations in Mississauga campus, Richmond Hill, Montreal, Calgary, and Vancouver. So you can speak with our representatives and staff and choose the right location for you. So this is the Prep Doctors website, prepdoctors.com, and I'm going to click on Canada. If you go to courses, we have AFK, ACJ, and the clinical skills, situational judgment, everything basically. And then we're going to go to NDECC clinical skills. Just to read more about the clinical skills course, it's a 12-week course, which is 3 months. The cycles are February, April, August, and October. This is when the cycles start every year. The location is available in all our campuses, and even an online option is available. The features that are there is that you can practice on NDECC simulators. There are demos by the qualified instructors, work checks, different instructors with different explanations and training, weekly live lectures, full 8-hour daily lab access, tailored feedback from course directors that will help guide you in the right direction depending on the level of your work. So after signing up for our course, you've brought your materials, you purchased your loops, you have everything ready, and you come to our labs. What are you going to expect there? Starting off with the 8-hour daily access to the labs. The labs are open 6 days a week, Monday to Saturday. The morning shift is from 6 a.m. to 2 p.m. and the afternoon shift is from 2:30 p.m. to 10:30 p.m. So you'll have the good amount of time every day to practice as if you have the real exam. You're going to be practicing on the NDECC simulators. The labs are also equipped with amalgamators, curing lights. Each unit also has individualized tablets that will allow you to access your learning management system. You can see your profile. You can rewatch lectures as you're practicing. You can also watch demos and replays anytime you need. So it's a very helpful tool. If you're someone that you like to watch the video as you're practicing, you can use your tablet on your station, watch the recording, and follow the steps as you're working. Another feature is the online weekly lecture. Our course directors and instructors will be available to help you and clear your doubts, especially when you are understanding the criteria of each tooth, each project, clearing any doubts, understanding the measurements. Like I showed you in the grading criteria, there's a lot of measurements that can be confusing, basically covering all the details needed or that you should know when you're learning all these projects is covered in the weekly lectures. These lectures are live online every Sunday, so you can follow up with the instructors and ask them live questions. If you have any doubts about the anatomy, any questions about the projects themselves, they are there to help you. Once you sign up for our Prep Doctors Clinical Skills course, you'll get a procedure manual. The procedure manual is a step-by-step guide that has pictures, explanations, basically a written manual for each project. And if you're someone that just doesn't want to rely on video explanations, you'll have the measurements, the pictures, the step-by-step cutting available for you to write your own notes and follow up at your convenience. Now, as you're learning your projects, you're going to need feedback. You're going to need someone to tell you, okay, this looks good, this doesn't look good, this is risky, you're in the safe margin, no, you're making a mistake. And to do that, two things, very important types of support are available by the instructors. There is the lab support available twice a week. So as you're working, the instructors will be available with you in the lab. They can answer all your questions. They can show you demonstrations. They can comment on your posture, on your techniques, anything you need inside the lab, they are there to help you. So with the personalized teaching method, there's also something called work checks. The work checks are there for you to have one-on-one sessions with instructors 2 times a week. These sessions are private and you will take your projects that you've done those 2-3 days that you've practiced and go to your designated instructor. They will see your projects through a 4K camera, show you your mistakes. They will give you tailored feedback and help you improve faster and give you from their own expertise. When it comes to booking your work checks ahead of time, you can do that through the learning management system, which is the same system that helps you track your progress. The instructors will use to grade you and give you the pass and fail marks. Another important thing to mention is the tracking system. So whenever you do a work check with an instructor and you show your projects, the instructor will not just give you the feedback in a conversation. They will also grade you on the learning management system. That way you can access your profile and know, okay, I was lacking in my MOD, or my amalgam wasn't good enough. I passed my class 4 composite, but I didn't pass my endo, for example. And that piles up over time, work check after work check, for you to be able to monitor your progression, and for the instructors to help you determine what projects need more work and what projects you're excelling in. So basically the point of all these features in this course is for you not to feel lost when you are preparing for this exam. It can be overwhelming, it can be time consuming, and you will only know that when you start practicing. You'll realize that there's a lot to learn, there's a lot of things that you don't know. It doesn't matter if you're a dentist from back home that practiced many years, or if you're a fresh graduate. The learning has to take its own time and done the right way for you to be able to be ready as soon as possible for your exam. There is no specific number of months that is predetermined for you to pass this exam. I can't tell you go take a year and practice and then go to your exam. It's safer. I can't tell you go 3 months and practice and go to your exam. This is personal progress, but the recommended months needed to prepare for the clinical skills based on statistics, based on previous results that we've had, is a minimum of 7 months. You have to keep in mind that the NDECC exam has 2 components as well. It's not just the clinical skills. You're also going to be preparing in parallel for the situational judgment, which is also going to be taking up your time. So if you're practicing the whole day in the lab, you have to also keep in mind that you need some time in the day as well for your situational judgment. The question is now, okay, I've practiced, I've done a good job on my projects. Why do I need to take simulation exams? You'll need the simulation exams for multiple reasons. One of them is to put you in the feeling of the actual exam. And a lot of people notice that after they do their mocks is that they say, okay, I don't know why on my mock exam I felt more stressed. I felt that I didn't perform as I usually do when I'm practicing on the normal days of the lab. And the answer is because this is the purpose of the mocks. It's supposed to simulate the real exam experience. It's supposed to make you feel like you are actually doing the exam so that you can time yourself properly. You're not as relaxed as any regular day. You're coming in the center to do a mock exam. So to walk you through the mock exam, the simulation exam experience for the clinical skills, you're going to arrive at the test center, at the labs of prep doctors on time, as if it's the time for the exam. So that means 8 a.m. for the orientation and 8:30 the exam will begin. There will be prepared typodont for you to start your exam. You will only bring with you your instruments and materials, your loops and your stuff. You can set them up before 8:30. When the time starts, the invigilators in the labs will let you know about the break time. They'll be assessing you on the infection control, and they'll be available for any support that you need regarding the simulators, the typodonts, or the teeth themselves. Once you complete your mock exam, you're going to leave your typodont behind. You're going to pack your stuff and leave, and the typodont will be taken to be evaluated. A couple days after the mock exam, you'll receive a full report of your performance. You will get a detailed report of each project, whether you passed or failed, and also the columns that you were evaluated on and what did you get in each column. That way you'll know that in this simulated exam, I was struggling with this project, or I didn't have enough time to finish this project. So you'll know how to move on from there and improve yourself based on that report. So just as important the clinical skills course is for training and learning the projects and getting the right feedback, the simulation exams are as important. They are going to give you that push you need to know that if I was in the exam, what could happen? How good am I? How my training can help me fix my problems, what to look out for, and push yourself until the last day. After each mock, you will get a one-to-one session with an instructor that's going to go over your performance on the mock. They're going to discuss each project with you, details on each project, what went wrong, what you could have done better, how to be safe, and so on. Now, a special feature only at the Mississauga location is the mock exam center. Once you book your exam, you are eligible to practice at this lab. The purpose of this center or lab is to also simulate the real exam experience. Instructors there are ready to help you as well and answer all your concerns. The stress can be at a peak closer to the exam date, and the center can help you focus more, let go of any distractions that you might have, and just sit down and practice for the last weeks before your exam. Because it can be overwhelming, planning for the NDECC exam, preparing for it, the courses, simulation exams, also financing all these things, that's why Prep Doctors has come up with the NDECC roadmap. The roadmap is there to help you plan out your NDECC journey, in addition to plan out the financing of it as well. Prep Doctors has teamed up with Windmill Microlending to formulate a plan for your NDECC journey to help you finance your courses, your preparation, your mock exams, up until the day of your exam with a 0% interest payment plan. All the information is listed on the website under the NDECC roadmap. In addition to the full YouTube video on the NDECC roadmap that we have, the YouTube video will explain everything about the roadmap, the financing, the rules for being eligible for this roadmap, and what you need to know before you sign up. To read more here in the website, we have the theory roadmap, which is for the AFK and ACJ journey, and the NDECC roadmap. For this video, I'm going to be showing you the NDECC roadmap. So the duration is 7 months, which is the minimum suggested number of months for you to prepare for this exam. And you can read about the explanation here. 0% interest monthly payment plan that gives you 18 months to pay. So instead of putting in thousands of dollars up front and burdening, yourself with whether you're taking it from a line of credit or having to figure out how to get the money, the payments are split up over 18 months. So the interest for you is less, and for the plan, you have 0% interest. This is the breakdown of the roadmap. So 3 months is for the NDECC clinical skills course. This is the course that I explained earlier. 3 months of the skills practice, and you also have situational judgment to think about. So 3 months for the situational judgment course, 3 months for the situational judgment practice, and the 1 month pre-exam clinical skills practice is, like I said, it's from a Mississauga location only, 2 fully simulated mock exams. So what does this package include? The details are here for clinical skills and the situational judgment. So make sure you check it out and read all the details. Mainly the purpose of this roadmap is to ease the burden financially on you and help you plan out your preparation. We've reached now the exciting part of the video, which is the exam day. Starting with the check-in. During the check-in, you will be issued an NDECC card. The photo IDs acceptable are the driver's license, passport, provincial photo identification card. Your name on the ID must match your name on your NDEB online profile. It must not be expired, so be careful with that part. After your check-in, you will have a video orientation at the test center when you enter the clinic. So you'll have a full orientation of the exam to kind of get an idea of what to expect. You'll have a mandatory break during the clinical skills, and you can only be in the candidate lounge for the break. You can take unscheduled breaks during the clinical skills exam, but you won't be given any extra time if you do. It's up to you. The situational judgment, you cannot take any breaks. And for both components, you can't leave the test center. So once you're in, you cannot leave until your exam is done. Just a few general tips for your exam day. Make sure you read the requirements very well. Sometimes your mind can play games. You might read something and then you miss a number and then you think, oh, it's the 1-3, not the 2-3, for example. So make sure you read the requirements very well. Make sure that you look at your typodon before you start. See if there's anything wrong. Tell the invigilators right away. If you're going to need any extra material during your exam, don't worry. They will supply you with it. Just tell them. As for the order of the projects you're going to do, there is no requirement. You can do them in any order that you want. But as a piece of advice, make sure you start with the projects you're more confident with. That'll give you a boost in the beginning to feel like, okay, I am on the right path and I'm at a good speed and pace to finish on time. In the exam itself, you're going to realize that the training really had a benefit for how you're doing your projects. You're going to realize that the way you're assessing your projects in a fast but efficient way takes a big part. Knowing when to move on from a project. So instead of spending 2-3 hours on one project, when it could be already a pass based on the criteria, the training takes place where you know that, okay, I put the right amount of time on this project, not too much to take away from other projects, but just enough to know that, okay, I am checking the criteria for this project. I finished it. I checked everything. It seems like a pass to me. And then you can move on to the next one. The goal and the best approach is to always finish before the time. And that goes back to your training, especially in the mock exam training part of your practice, when you aim in your mocks to finish before 5 o'clock. Ideally is an hour, half an hour before the time ends. That way you'll have that extra 30 minutes, 45 minutes to check everything again and again and again, and you'll feel comfortable and relaxed by the end of the exam. And most importantly, be confident in your practice, be confident in the effort and the time that you've put to prepare for this exam. You will be putting months and months of your time, so get yourself in the right mindset. Approach things with confidence and also speed. So we've reached the results part of the video. And like I mentioned before, the results usually come out at least 6 weeks after the evaluation session. When you get the results, you get an email that says that your results are released. You're going to log into your NDEB Connect account, click on results, and check the latest one posted. When you go in, the results are going to show up as pass and fail. So for clinical skills component, it has a table on its own, and it's going to show your project as amalgam pass, a class 2 composite pass, provisional pass, or fail. And at the end of that table, you'll see whether you passed or failed that component. If you got 8 out of 8 passes in the clinical skills, you will pass the component. If you got fail on any of the projects in this component, then you fail the clinical skills. For the situational judgment component, you'll also get a table and you'll get to see a pass or fail for each competency and station that you did. To pass the situational judgment, you need to pass 6 out of 10 stations without failing 2 stations in the same competency. I'll go more into detail on that part in the part 2 video. Now, based on your results, if you passed both components, congratulations, you can move on to the OSCE. But if you failed any of the components or both, you have to repeat them. So let's say you passed clinical skills and you failed the situational judgment, you have to repeat only the situational judgment component, and vice versa. When it comes to the cost of the NDECC exam, it is $7,000 for the full exam. If you pass one of the components only and you have to repeat, then you have to pay only for that component, which is going to be
$3,500.
You have unlimited attempts within a 5-year period. So from the first time you attempted the NDECC, counting 5 years from that date, you can do the NDECC unlimited number of times. However, knowing the registration times and the time needed to get your results and the time after your results that you're able to register and then wait for your exam, it's going to be a 6 months period. So technically it is unlimited, but you will only be able to do this exam twice a year. So as listed on the NDECC protocol, the NDECC may be taken any number of times within 60 months of the date of the NDECC is introduced or from the date you pass the ACJ, whichever precedes. If you fail either the clinical skills or situational judgment component, you're only required to retake the failed component. As for the report of results, you will receive a pass or fail result for the entire examination. So even if you passed a component, the official result is going to say fail. You still have to click on it and see the full report. You might have passed clinical skills or situational judgment. Prior to the examination, you'll be informed when your work will be evaluated and the time frame for release of your results. So they'll give you an estimate time frame when to expect your results. But you won't know an exact day when the results will come out. I just want you guys to know that even if this information seems overwhelming, and if you are an ACJ right now or AFK right now, and you're looking at this and you're like, okay, this is a lot. This is a lot of information. This is very expensive. I don't know if I can do this or not. Trust me that I have seen a lot of people who pass this exam, and this can be done by following the right steps. Do not skip any steps. Don't try any shortcuts. There's no such thing as training at home for a month or two and then showing up to the exam and hoping for the best. You'll be investing a part of your life for this exam, but the reward out of it, the outcome is worth it. You have to put in the right effort and you will see the result that you deserve. We have reached the end of the video. Make sure you watch our part 2, which is going to go in depth into the situational judgment component. I hope you guys enjoyed this video. If you have any questions regarding this exam or any other exams in the process, don't hesitate to contact us at Prep Doctors. Our staff is more than happy to help you and guide you. We also offer one-on-one consultation sessions and financial advising sessions for free. I hope you guys enjoyed this video. I will be releasing part 2 very soon, so stay tuned and I'll see you in the next video.